In today's procedure, we are operating a patient with leg fracture. So we have scanned the. Now we are applying the antiseptics. So antiseptics has been applied. Now we are clearing the point where you have to make a cleavage to see the bone and make a successful operation. Now we are marking the point where we have to apply our cleavage system. So we have cleaved the leg splash successfully. Now we are opening the bone to see what has happened to the bone. The bone is completely fractured with both sides, so we have to stabilize the bone with a rod. We have applied a stabilizer. Now we are applying the spray. We are closing the wound. After that, we will apply the stitches. Now we are applying the stitches. About 5 to 6 stitches are enough. Now we are applying the bandages. Now the patient is ready to expect.